You talked about gonorrhea giving you signs and symptoms, which can be painful urination, there may be some discharge that can be seen, that type of thing. Now with that, what are the treatments for it? And if it's not treated, left untreated, what would be the consequences?
Gonorrhea, interestingly, is a disease which has been around for a long time, actually, since the dawn of history. The main breakthrough was during World War II when penicillin was discovered. And interestingly, if you look at World War II, over half the GIs, by some estimate, had gonorrhea. So at that time, it was even mandatory to get penicillin shot if you were suspected. Some of the gonorrhea strains, though, have become resistant. So you have to be careful to make sure that your physician actually tests you, and also if you're not responding to treatment, you know, to look into it some more. But generally, it's very simple. We can give you pills, or we can give you one shot, and that will take care of most infections of non-resistant gonorrhea.
Okay.
Also, what people forget is they can have gonorrhea of the mouth through oral sex, and a lot of people forget that. Okay. But all these are easily treated with penicillin, all these derivatives.
Okay. Now, if you have it of the mouth, of the oral cavity, are you going to have a lot of sores? Difficulty swallowing, eating? What are going to be some symptoms the person's going to know that something's up?
Certainly all of the above symptoms that you talked about. Sometimes they'll present as a simple sore throat, where it may be mistaken for strep throat. So again, if you practice unprotected oral sex, yes, you are at risk for that. Okay. But the good news is all this is easily treatable if it's diagnosed. Now, you talked about complications.
Right, if it's not treated.
Yeah. The biggest complications, especially for women, is pelvic inflammatory disease, which will be a scarring of the fallopian tube. And this, again, will make most women sterile if they have the fallopian tubes blocked. So it's important that if you think you have symptoms of gonorrhea or any sexual transmitted disease, to be adequately treated.
Now, can the same type of sterility issues affect men? Can there be blockage there where they themselves, they also can become sterile?
Yes, men can have complications of gonorrhea, which can again affect their reproductive capacity. Not only that, you can also have what we call septic gonorrhea, where it affects your joints. And that can be fatal because you can get what we call septicemia, where literally your whole blood is infected. So that can be also very dangerous.
Okay. Is there any sort of impact on neurofunction, the brain, that type of thing?
Generally, though, the one disease which is commonly attributed to neural functions is syphilis. Okay. Because you can have tertiary syphilis, which literally can drive you insane. Because again, tertiary syphilis is very advanced syphilis, which is not treated. And
Okay, now let's swing on into syphilis. That's my intro into that. Tell us, in terms of syphilis, what are some of the sort of symptoms that a person has with syphilis, if it's similar to the others, or does it have a twist to it? Tell us about that.
Syphilis has a twist to it because generally when you're first infected, most people will feel like they had a low febrile illness, you know, flu-like symptoms, cold, joint ache. And interestingly, that will disappear in about a week or two.
Like the real flu does.
Like the real flu. But then the syphilis then stay dormant. And then you end up what happened probably, you know, genital sores, or you have rash. But syphilis has really very definitive progressive stages, and we kind of talk about it all in the show. But basically we look at three main stages, where the initial flu-like symptoms may go away. Secondary stage, you may have like a rash-like syndrome and an illness, and again, you may have genital sores. Okay. And then, interestingly, after the first and second stage, it may disappear completely, only to reappear years later as tertiary syphilis. So that's what makes syphilis so dangerous.
Okay. Now with syphilis, because it can go into those dormancy phases, once again, on an annual checkup, if the person's not coming in before because they're thinking they had the flu and that went away, you know, they can explain away everything. is there going to be a test that's naturally done with that annual physical to also detect whether a person has the syphilis, as well as we mentioned the other in terms of chlamydia or gonorrhea, but is the full battery for all of the most common sexually transmitted diseases on the annual physical?
Yes, again, we can order specific tests for syphilis. And again, with syphilis, you have to make sure that you are adequately treated. Sometimes also people can test what we call false negative for syphilis, especially in some rare cases where they are under medications. Your syphilis test may be positive. So sometimes we have to confirm the screening test.
Okay. Let me ask one other quick question. I'm going to switch to one other before I run out of time, one other condition. With syphilis, when you go into the dormant phase, people may wonder if it's dormant, can it be transmitted to others?
Yes, if you have syphilis which have not been adequately treated, yes, you are at risk of transmitting it anytime you have unprotected sex. And again, that is what makes syphilis so dangerous, through history. Because people may, again, not have any symptoms after the initial phase wears off. Okay,
let me ask about trichomonas or yeast and bacterial infections, because that tends to be very common too. Tell me about those types of infections, and are they transmitted from one partner to the other?
Yes. Trichomonas is also especially interesting because, again, sometimes men who have it may not have any symptoms at all. Most women will complain of itching in their private area, vaginal itching, and also trichomonas is dangerous. It also causes a lot of miscarriages. Some women may have it and again not have any overt symptoms, but again on a gynecological exam, the physician can take a good look at a cervix and based on what he or she sees can easily diagnose that. Again, we have a special test. With trichomonas, sometimes we can pick it up in urine samples, but it may need a pelvic sample to definitively.
Now, if this is a condition that you have, like trichomonas, and you may not know whether your partner has it or not, is the partner automatically going to be treated as well, just in case?
You bring an interesting question. That's always the dilemma of physicians. Generally, the advice is that if you have been tested positive for any sexually transmitted disease, you owe it to your partners to let them be aware of it so they can be treated. It gets tricky when you are in a situation where a person has had multiple partners. Then the question is, we contact all partners you've had. I leave that choice to both the patient and your doctor, but you owe it to anybody you've had unprotected sex with, if you tested positive, to let them be aware of it.
Okay, really two quick questions. Are there any of these conditions that we've mentioned, the syphilis, the gonorrhea, chlamydia, trichomonas, that you have to report to the health department or higher officials?
Yes, actually, the mere definition of all sexually transmitted diseases are reportable. What I think happens is, especially people who go to their private doctors may not necessarily have it reported, but the health department have specific guidelines for reporting all sexually transmitted diseases.
And people shouldn't be afraid of that, because in the reporting process, no one's going to come out like the sexually transmitted disease police and lock you up or anything like that. It's so that contacts can be acquired and treatment can be obtained.
Exactly.
Right. And one other quick question, because they tell me I'm running out of time, in terms of newborns. When they're born, is there still some treatment for the eyes, just in case there was some type of sexually transmitted disease that the mom had that was not picked up on?
Right. And again,
that still occurs.
Almost any sexually transmitted disease, if a mother has it, potentially can transmit it to the child during childbirth. And so children routinely get eye drops for gonorrhea, and also chlamydia that we talked about. What is important about chlamydia is one of the leading causes of blindness.
So there is treatment.
All over the world, but there is treatment for that.
Thank you so much, Doctor. I know that was fast, furious. I'll have to have you back because there was others we didn't get to, of course. Thank you so much.